Now to matters Social Health Authority. Acting Social Health Authority Chief Executive Officer Elijah Wachira has directed all healthcare providers in the country to continue using the hospital's insurance claims management system to admit and discharge patients in hospitals as they work on the new provider portal. This latest development comes as uncertainty grips dialysis patients in the country who relied on the critical service that was in the past offered under the NHIF scheme in most private hospitals, but proving difficult under the new health scheme. Marian Nyambura reports.
26-year-old James Kanyori, a dialysis patient, is a bitter man. We meet him in Nakuru as he heads to a private medical facility within the city. He requires a life-saving procedure: dialysis. This is his second attempt today, but the hospital is skeptical about offering dialysis to Kanyori, who had previously acquired the service at the facility under NHIF. The confusion surrounding the transition from NHIF to SHA putting his life at risk.
Wende waambie watu yenyu watoe pesa 9,500 na sasa mimi sina mahali ya kutoa pesa. Mimi ni mzee miaka 76. Sina pesa. Sina mahali nikiomba.
Kanyori leaves the hospital without the required care. He did not have the money.
Sahi niko mgonjwa. Damu haendelei. Sasa damu haifanyi kazi sasa. Sababu sina figo.
Florence Nyandieka, a caregiver, brought her husband to the hospital, but had to part with 8,500 shillings for one session.
Sikukuwa na hiyo pesa, ngakaa patara ya kukucha Tuesday, ngakucha leo ngauza mbuzi 2, ngakucha kumtibu hapa. Lakini wiki nyingine sioni mahali nitaenda niende kuuza kitu, sina kitu yoyote ya kwenda kuuza tena nimulete hapa.
The Kenya Renal Association has warned that the bumpy rollout of SHA has left dialysis patients in limbo.
For the sake of our patients, we want things to be a bit smoother. We want things to be handled a bit with more sensitivity. If need be, they give a special separate contract, a legal contract to dialysis service providers so that the dialysis patients can continue accessing this service.
I just hope that it doesn't cause a long-lasting impact on the lives of our patients, because before this directive was issued that NHIF should reimburse dialysis services, we had less than 600 patients on dialysis. Currently, we have more than 8,000 patients who require regular dialysis every day.
Amidst the rocky transition, hospitals will now be required to admit and discharge patients using the hospital insurance claims system that was in use before SHA was rolled out. A letter seen by Citizen TV, penned by acting SHA CEO Elijah Wachira to all healthcare providers in the country, reads in part, quote, "You are hereby notified that during the ongoing rollout of SHA, you are advised to continue using the hospital insurance claims system to admit and discharge patients at your facility. This system will remain operational and operate parallel as the authority implements the new provider portal, which will be used to verify and process claims." End of quote. This comes as Treasury CS John Buddy admitted that the ministry does not have sufficient funds to support the SHA rollout wholly.
Well, I know that we have challenges with funding this program. But again, I think the government also took a deliberate effort. You know, some of these things, if you keep on putting them, procrastinating and putting them as stories, you'll never implement them. So at times, it is better to roll out, face the challenges, resolve them as you move forward.
Thousands of dialysis patients wait to see if the government will act fast and just how the new health insurance provider SHA will benefit them. Marian Nyambura, Citizen TV.